Hello everyone. Today we are going to discuss about the anti-leprotic drugs. I, Pankaj Kuspe, welcome you all for this session. I am working as an assistant professor in Vidyaniketan College of Pharmacy, Lakewadi. So, what will be the learning outcome for our today's session? So, upon completion of this chapter or this session, student will able to understand the definition of leprosy. Student will understand the definition and classification of anti-leprotic drug. Student will able to rewrite the structure and IUPAC name of dapsone. Also, student will able to rewrite the properties and uses of anti-leprotic drug. With this, student also able to examine the various official preparation of anti-leprotic drug in the market, and they can able to select the product of various brand name which are used as a anti-leprotic drugs. So these are the learning outcome of this chapter. Syllabus. So the syllabus given by PCI consists of four main drugs that we have to discuss. First is dapsone, second is clopazimide, third is thiambutocin, and last is solapson. Out of this, we have to discuss the structure and IUPAC name of dapsone only, and the properties, uses, storage, official preparation and brand name of remaining drug, that is clopazimine, thiambutocin and solapson. So the question asked on this particular chapter in a MSPT final examination are: first, the most important question which are generally asked in examination are: give structure and chemical name of dapsone. This question is asked generally for 3 marks. Also, the same question is asked in the leprosy. So, what is leprosy? First, before starting with the actual concept of anti-leprotic agent, let we clear or we get the idea of leprosy, and then we will understand anti-leprotic agent. Leprosy is also known as Hansen's disease because Dr. Hansen's discovered the leprosy. So, in remembrance of Dr. Hansen, we called leprosy as a Hansen's disease. Why leprosy is caused? Leprosy is a communicable chronic infection caused by infection of Mycobacterium leprae, which is a bacteria, and upon infection, it mainly affect the skin, peripheral nerve, mucosal layer of upper respiratory tract, and the eyes of patient. So this will leads to degradation of the fingertips and the skin also. So leprosy is all about infection of Mycobacterium leprae to the patient and causes various symptoms. Now we are going to move for the next point, that is definition of anti-leprotic agent. Now we get the concept of leprosy because the Mycobacterium leprae causes infection to the patient and leads to the disease that we called as a leprosy. So the drug or the agent which are used for the treatment of or used in the treatment of leprosy are known as anti-leprotic agent. The definition is quite simple and easy. The drug which are used in the treatment of leprosy are called as a anti-leprotic agent, and the example of anti-leprotic agent are dapsone and other non-sulfone compounds also. Next point, classification. In classification, there are two main classes are there. First is solapsone. The example of this class is dapsone and solapsone. Second class from this anti-leprotic agent are non-sulfone group, which consist of two subclasses. First is thiosemicarbazole derivative, example thiambutocin, and second subclass is phenazine derivative, example is clopazimine. So this is the classification of anti-leprotic agent. Keep this classification in your mind because sometime in final MSBT examination they may ask the classification of anti-leprotic agent in their paper or an examination. Next point, now we are going to start actually with first compound dapsone. Dapsone, the structure of dapsone are present on the screen, which consist of basic suffix sulfone in the middle with two phenyl ring and two amino group in it. So the IUPAC name of dapsone is 4,4-diamino diphenyl sulfone, or we can call it as a bis 4-amino phenyl sulfone also. Why we call it as, or how we give name to this particular compound in this way? So let we understand how we give this IUPAC name or chemical name to the dapsone. So first it consists of basic group SO2, that is sulfone, which we considered as a suffix. And on this sulfone group there is a presence of two phenyl group, first at a left and first at a right. So diphenyl is present on sulfone. With this group, again one more group is present on this phenyl at a 4 position, that is amino group, one at a right and one at a left. So the ultimate two amino group, two phenyl and sulfone, which leads to the name of dapsone as a 4,4-diamino diphenyl sulfone. Next title is properties of dapsone. So dapsone is a white or creamy white color crystalline powder. It is odorless in nature and having slightly bitter taste. It is very slightly soluble in water, but it is soluble in various organic solvents like acetone or various mineral acids. So storage of dapsone is, it should be closed in a light resistant container at a cool place away from direct sunlight. The reason of using light resistant container is that dapsone is light sensitive. So when you keep dapsone in a direct sunlight, it will lead to the degradation of dapsone and reduce its therapeutic effect. That's why to protect dapsone from its degradation, we need to keep dapsone in a light resistant container. So with this, we are finished with the storage. Next title, dapsone. Uses of dapsone. First, it is used in the treatment of leprosy. Second use, it is used in the treatment of malaria also by combination with other anti-malarial drug. Dapsone is also used in the treatment of various dermis diseases or dermal diseases, which includes dermatitis herediformis or replacing polychondritis with other skin product. Next use of dapsone is, it is used in the treatment of pneumonia by combination with trimethoprim. Official preparation of dapsone consists of, first dapsone Indian Pharmacopoeia, British Pharmacopoeia and United States Pharmacopoeia. Next dapsone tablet Indian Pharmacopoeia, and the last one is dapsone gel Indian Pharmacopoeia. The brand name of dapsone are, first Dribonax, second is Axone. So you will get the diagram of Axone also on the display. So it is a gel prepared by the Valent Pharmaceuticals. Next, now as I told you, we are going to revise the point we have discussed in earlier lecture. So small point, that is classification. I already told you in some examination they may ask you to classify the anti-leprotic agent. Did you remember that? Yes? No? Okay. So here is the answer of this question, that is classification of anti-leprotic agent. As we know, it classified into two types, that is sulfones and non-sulfones. I hope so you are able to write the answer of this question. Next, second drug that we are going to discuss is a clopazimine. So here we are going to discuss the properties, storage, uses and various other things of clopazimine. So as you able to observe, the color of clopazimine is a dark red to orange red color crystalline powder. It is odorless, it is insoluble in water, but it is soluble in organic solvent like chloroform. Clopazimine is not light or moisture sensitive. That's why the storage of clopazimine is like, it should be stored in a well closed container at a cool place away from direct sunlight. Next title, the uses of clopazimine. Clopazimine is used in the treatment of leprosy. Also, majorly the clopazimine is used in the treatment of lepromatous leprosy. This is a type of leprosy in which we use the clopazimine for the treatment of leprosy. Next, official preparation of clopazimine. The official preparation of clopazimine are clobazamine Indian Pharmacopoeia, British Pharmacopoeia, and clobazamine tablet Indian Pharmacopoeia. The brand name of clobazamine are clofazine, lamprey, and clofazimine. So these are the brand name of clobazamine. Next, third compound from this chapter is thiambutocin. Thiambutocin is a white to creamy white color crystalline powder. It is having bitter taste and don't have any specific odor, that is odorless. It is very soluble in water, but it is soluble in acetone also, that is it is soluble in organic solvent also. The storage of thiambutocin is it should be stored in a well closed light resistant container at a cool place away from direct sunlight. The reason will be again the same, that thiambutocin is light sensitive. That's why to protect thiambutocin from its degradation, we kept the thiambutocin in a light resistant container. Next title, uses of thiambutocin. Thiambutocin is used in the treatment of leprosy. Second, it is also used in the treatment of tuberculosis leprosy. Third use, it is used in the treatment of severe neuritis also. Next, what is this severe neuritis? Severe neuritis is nothing but the condition in which when the leprosy or the bacteria which causes leprosy, Mycobacterium leprae, infect the skin first, and from skin it moves to the nerves, and when it infects the nerves it causes pain. That condition is called as a neuritis, and in that condition we use the thiambutocin for the treatment of that infection to cure that pain. That is, it is used in the treatment of severe neuritis. Next, official preparation. First official preparation is thiambutocin Indian Pharmacopoeia, United States Pharmacopoeia. Second preparation is thiambutocin tablet Indian Pharmacopoeia, and the brand name of this thiambutocin is SIBA 1906. Next, and the last compound from this chapter is Solapson. So Solapson is a white to creamy white color odorless crystalline powder which is very soluble in water and soluble in acetone also. It should be stored in a well closed container in a light resistant container at a cool place away from direct sunlight. Again the reason will be the same. Solapson is a light sensitive compound, so it will be stored in a light resistant container. Next title, uses. It is used in the treatment of leprosy. Official preparation of Solapson are Solapson IP, Solapson tablet Indian Pharmacopoeia, and the brand name of Solapson are Dibronax, Simedone, Sulfatron, Sulfasolone, and Sulfanum. So these are the brand name of Solapson. So with this brand name, we are here finished with the various drugs which are used in the treatment of leprosy, that is anti-leprotic drug. I hope so you understand this point. Thank you very much.